Good afternoon, everybody, and welcome to the Center for Practice Excellence Speaker Series. My name is Zubin Austin, and it is my pleasure to welcome you to today's event, which is going to be focused on pharmacy advocacy. I'll turn it over to our center administrator, Annalise, to introduce today's event, provide our land acknowledgement, and introduce our guest moderator, Mike Sullivan, this year's leader in residence at the Leslie Dan Faculty of Pharmacy. Thanks for joining us, and over to you, Annalise.
Thanks so much, everyone, and thanks to everyone joining us. We do have a pretty big group today, so I just wanted to take a minute to just briefly introduce that the Center for Practice Excellence is based out of the Leslie Dan Faculty of Pharmacy here at the University of Toronto, and we focus on pharmacy education and training, research, and practice and innovation. So this monthly speaker series is really where we get to learn about and sort of discuss very critical issues impacting the future of healthcare and pharmacy. And just before we get underway with our programming today, I just wish to acknowledge this land on which the University of Toronto operates and where I'm located today. For thousands of years, it's been the traditional land of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit. Today, this meeting place is still the home to many Indigenous peoples from across Turtle Island, and we're very grateful to have the opportunity to work, learn, and live on this land. So we're very excited for today's event, particularly as it's taking place during Pharmacy Appreciation Month. And today's event on the challenges and opportunities as a pharmacy advocate will feature a panel moderated by Mike Sullivan. Our panel will speak for about the first 40 minutes or so, and then we'll have 15 minutes towards the end for audience question and answer with you. As a quick housekeeping item, just because we will have a large group today, I'll just ask that you keep yourself muted during the event and just kindly put any questions and comments that you might have for our panelists into the chat, and we'll triage those accordingly. Also just acknowledging that there's lots of things going on in pharmacy, so I'll just ask you to be kind and considerate in your remarks. So just to introduce the fantastic panel and moderator that we have joining us today, Mike Sullivan is our 2023-2024 Leader in Residence here at the Faculty of Pharmacy. The Leader in Residence program really provides opportunities for community building and engagement across the University of Toronto and with our external partners. We're looking forward to Mike sharing his expertise, experience, and networks with our CPE community, and we're really thrilled to have him moderate today's discussion. Our first panelist for today is Jen Belcher. Jen began her career as a pharmacist practicing in community and hospital pharmacy after graduating from the Leslie Dan Faculty of Pharmacy in 2013. She served on the board of directors for the Ontario Pharmacists Association from 2015 until 2021 as the Eastern Ontario representative and led the board as chair throughout the COVID-19 pandemic. Most recently, she's joined the team at the Ontario Pharmacists Association as the Vice President of Strategic Initiatives and Member Relations, where her skill sets in clinical practice, pharmacy operations, and advocacy help to lead the work of the association. Our second panelist for today is Shalita Datani. Shelley is the Senior Vice President of Pharmacy Affairs and Strategic Engagement at the Neighbourhood Pharmacy Association of Canada. In this role, she leads a team advocating for pharmacy's evidence-based role in delivering accessible, high-quality healthcare and building capacity in public health and primary care. Shelley maintains a practice in community and primary care, and she also holds teaching appointments in pharmacy as adjunct faculty at the University of Ottawa, a sessional lecturer at the Memorial University of Newfoundland, and a guest lecturer at the University of Waterloo. And our third panelist today is Danielle Pays from the Canadian Pharmacists Association, where she's the Chief Pharmacist Officer. At CPHA, she's driving strategic efforts in the areas of pharmacy practice, workforce sustainability and diversity, equity, and inclusion. She's focused on enhancing the wellness of the profession so that pharmacists can continue to meet the emerging health needs of their patients. Her motivation to work in advocacy is rooted in her desire to contribute to a field of pharmacy and a future of pharmacy where the profession is thriving, unified, and practicing to its full scope to make a meaningful difference in the lives of Canadians. Thank you so much, everyone, for joining us. I will now pass it over to Mike, who will get us started with the panel questions.
Good afternoon, everybody. Thanks very much for joining. Just a quick housekeeping note. If anyone is more comfortable sending in a question via email as opposed to putting in the chat, my email address is pretty simple to remember. It's just Mike sullivan@cubic.ca. If you'd prefer to just send an email there, and even if your preference would be to not have it attributed to you, just asking more generally, then by all means, please do so, and I'll keep an eye on that and bring any of those questions into the conversation once we wrap up our initial panel discussion. So please don't hesitate. Otherwise, if your questions in the chat, then Annalise and I can certainly coordinate from there. Also, just a quick note that, and we had this conversation before we started, we've got three very dynamic and articulate and very passionate pharmacists speaking here on the panel, and I have no doubt that I'll have to jump in and interject and cut off the conversation. So I've already apologized to them in advance for doing that. It's super ironic because I'm the most long-winded person I know. So any of you who know me, I apologize for doing this. But in the interest of making sure we get through our program and have some time for Q&A, that's great. The other thing is too, we would love any feedback you have. I think as part of the audience, one of the things that'd be really helpful is if this conversation is sort of going in a direction where you think there's opportunity to dive in a bit more and explore a bit more deeply, we'd certainly appreciate that feedback, Annalise, Zubin, or myself. So don't hesitate to email that to us if you've got any ideas about where you'd like to see this conversation sort of move on a go-forward basis. So we'll jump into it. It's really interesting timing. It was actually 40 years ago this year that my father pulled me out of school as an elementary school student to have him to fill medication cards for his nursing home patients because his staff, a bunch of them had gotten sick or something to that degree. It's been 40 years of being connected to pharmacy, starting with that. And I'm not sure I can ever remember a time that's been more dynamic than it is right now. So this topic is obviously, as Annalise mentioned, extremely timely. So we'll get into the first question for the group. And the first question is, I'd like to start off by asking each of them to describe a bit about what advocacy looks like in each of their respective organizations. And maybe I'll start with Jen and then go to Shelley and then wrap up with Danielle. So Jen, why don't I turn it over to you?
Thanks so much, Mike. So as Annalise had introduced, I work for the Ontario Pharmacists Association and had the distinct pleasure of both serving on our board of directors and now working as staff. And ultimately, I think I still learn every day what advocacy at our association looks like, because there are so many ways in which organizations such as your professional associations advocate on behalf of our members. So at OPA, of course, we are the provincial association that advocates on behalf of Ontario's pharmacy professionals. And with that, we spend a significant amount of time looking to lead both, the formal and assist with some of the grassroots advocacy initiatives that will bring the issues and interests of Ontario's pharmacy professionals to the tables of our main stakeholders. Primarily, of course, the Ontario government, with health being, a provincially administered issue, and so many of these interjurisdictional differences, but also alternative stakeholders like perhaps third-party payers, our partners in other professions, in other realms of pharmacy practice that do meaningfully touch on how our pharmacy professionals interact with their patients. And with that, we have a team of approximately 26 individuals at the organization that support everything from government relations and communications, stakeholder relations, through to the supportive elements of what we need to do in order to ensure that pharmacy professionals are equipped with the supports, tools, references, and continuing education to implement initiatives that we've advocated for. So we sort of, we represent approximately 10,000 pharmacy professionals across Ontario, and always looking to grow in the ways in which we support and provide value back to pharmacy professionals.
Thanks, Jen. Shelley, I'll turn it over to you.
Sure. Thanks, Mike. And just to let everybody know, I'm not sitting in Jamaica somewhere with the sun beating on my face. I'm in Ottawa and my blinds are opaque. So I apologize for the shadow because the sun is beating down on my face here in sunny Ottawa. So happy to be here today. So first of all, thank you to inviting me to speak on behalf of Neighbourhood Pharmacies, but I'm so excited to be here with my two friends and colleagues. We at Neighbourhood Pharmacies are a national association, and we represent the business of pharmacy. I do think that traditionally, because our name was originally CACDS, or the Canadian Association of Chain Drugstores, a lot of people think of us as the association that represents corporate and chain pharmacy. And I wanted folks to recognize that than ever. Our pharmacy members, our pharmacy operators have very diverse business models. So whether it's corporate chain, independent, grocery, dedicated specialty, or others, in fact, the majority of our members currently are independent pharmacies. So I think that's something important to remember is the diversity of whom we represent. But also because of where most of us work and practice in community pharmacy, it's very hard. And Jen and I had a conversation about this years ago to decouple the practice from the business in terms of sort of where we work. And of course, there's professional autonomy, but there's, and we'll get into this, there's more similarities than differences in the issues that we represent on. I will also say that we do have a little bit of a pan-Canadian voice. And what that means to us is not that we're deep in provinces where healthcare sits, like Jen said, but that we see ourselves as a bit of an honest broker between federal governments and understanding how healthcare is implemented provincially, particularly at the pharmacy level, and being able to bring that dialogue federally. So I think that's a little bit of a unique sort of perspective that we offer as well that I wanted to share. Thanks, Mike.
Thank you very much, Shelley and Danielle.
Amazing. I'm like so excited to see all these names here. So thank you all for being here. I'm having all these moments of warm fuzzies as I see who's on the call. So CPHA is a national organization. We represent the voice of pharmacists and pharmacy in Canada. We are an association of associations. And so when you belong to your provincial association, you are directly linked to the work that we are doing on a national level. Advocacy at CPHA takes many forms. Each and every day is a little bit of there's new opportunities to ensure that the pharmacist's voice is heard in meetings, at roundtables with governments, with media. We work with a variety of stakeholders to understand the issues that are impacting pharmacy. And that includes everything from drug shortages to current health trends, so measles, there's a lot responding in real time to the issues as they emerge. And we develop strategies on how to support pharmacists and how to support pharmacy teams in ways to support their patients in the communities that they look after. So that includes public opinion polling to find out what Canadians are looking for from their pharmacy teams. We support practice research. We submit grant applications. One of our most recent ones includes a focus on how do we support international pharmacy graduates integrate into the Canadian system with more ease. And then we use the data that we find through these avenues to encourage governments to enable and fund pharmacy services. And last week, I have to say this, last week was probably one of the biggest advocacy weeks I've had since I joined CPHA. So in addition to our new strategic plan that was released, we took a firm stance against payer-directed care with PPNs. We filed a formal complaint with the Competition Bureau against Express Scripts Canada. We lobbied for inclusion for pharmacists at the table and in the decision-making as we shape pharmacare. And we went live with our winter 2024 release of CPS. That's not really linked to advocacy. It's more of a shameless plug. But then just a glimpse of what advocacy looks like for us here at CPHA.
Thank you, Danielle. The three of you referenced your mandates, obviously different. We've got a national organization working in different areas, two national organizations and a provincial organization. So clearly some slightly different mandates, but obviously a lot of alignment and overlap between your organizations and then it's advocacy for the profession. So perhaps I could call you to maybe draw some examples, and Danielle, you've touched on a few, to highlight some of the synergies and collaborations between your organizations. Shelley, maybe we'll start with you.
Sure. Thanks, Mike. So first of all, I think as Jen and Danielle and you have already said, we're at a very, very critical time in the profession and the sector. We're coming out of probably the most profound health crisis that we'll ever see in our lifetimes, and we're already finding that our memories are short. In my view, we're facing acute on chronic pressures that we've never seen before. in this country. There's a lot of disruption. Some is positive and some is threatening. And Danielle alluded to some of those things that, you know, we're all working on. So it's really critical to come together to the proverbial table. And I'm going to steal from my colleague, Jim Danahy, who I think is on the call. And he said something, and I love this: if you're not at the table, you're on the menu. And this is sort of how I'm feeling right now. And I think when we think about what advocacy means, and I actually looked this up, Mike, advocacy is about influence, and there's power in numbers. So aligned voices that are united are going to carry greater influence. And that's really, really critical. And I think that, you know, for us, I'm confident with the three of us and our three organizations, and actually all of the pharmacy bodies across the country. I fundamentally believe that there's alignment on our positions. So whether it's pharmacare, whether it's federal price compression, whether it's provincial funding models, whether it's scope, markup reform, HHR, professional well-being, you know, payer-directed care, you name it. Fundamentally, I really truly believe that our North Star is the same, and that's investing in a healthy and strong, sustainable sector that can provide excellence in care. And for the three of us and who we represent, mostly that is community-based care, that can bring the already demonstrated value and fill the gaps in a health system that's going to struggle for years to come. Our rear view mirrors are looking at the pandemic behind us, but we have a lot of catch up that we need to do. And with some of the hot button issues, again, that others have alluded to that are facing us right now, like Danielle said, last week was a crazy week. This week is a crazy week, but you know, it is all hands on deck time. There is much work to do. There is an aligned voice, and I think it's really critical. We've seen this in the US with PBMs. You know, they have 30 national associations, and they came together because, again, advocacy is about being united, being together, being aligned, having a greater voice together. Maybe I'll stop there because I could go on, and you're going to have to start cutting us off soon, Mike, but I'll let others chime in.
Thanks, Shelley. No, that's good. It's a really important context. Danielle, you started a list of some of these examples. Maybe I'll let you just expand a bit on what you mentioned in your earlier comments.
You know, it's so interesting. Synergy is so important, and I think one of the things that's so valuable is that we are aligned in so many ways. And so now that we're aligned, how do we as organizations, as individuals, as teams, really start to activate within our own spheres of influence to share those same messages? So, you know, when we try to align wherever possible on key messages, on strategies, on data, you know, we have the benefit of being a national organization where we can learn from the different provinces. So unfortunately, the different provinces are in a different place. You know, the regional experience, the provincial experience, it's all going to vary depending on who you're talking to. And it really there's value in that, in the sense that we can use the data from the experience in Nova Scotia and share it with our other provinces to say, here's what worked really well. Here's data that you can take into your meetings to equip you. So when you're doing your negotiations, there's some foundation that you can rely on. So that's just one example. There's so many different ways we collaborate. I wanted to take time to highlight, speaking on the topic of collaboration, I feel it's important to recognize the incredible amount of non-pharmacist talent that we have at our associations. It's often, I feel it's underappreciated. There are many individuals that are working at our associations that are dedicated to advocating on our behalf. It's one thing when you're a pharmacist and you dedicate your careers to advocacy. It's a whole other ballgame, I think, when you can bring your legal, your business, your communications expertise. And I want to say I've had the immense pleasure of working alongside some remarkable leaders who are sort of caring or are there with us and allies in this, bringing their expertise to the table. So I just feel like that's so important, because as pharmacists, we have a lens that we look at. And so it's really nice to be able to have that other perspective so that we can tackle some of these problems putting all our heads together.
Thanks, Danielle. And Jen, from your perspective, where are you seeing from the OPA's view where some examples of some of this, I guess, alignment on collaboration opportunities?
Yeah, I think it's absolutely critically important, especially when, I think from the Ontario specific context where we're often the province that lags everybody, or maybe not everybody, but we're usually one of the last to move, especially on big issues. So we think recently to the expansion of scope of practice that we have for pharmacists with the minor ailments program. And so much of that data and supporting evidence that came from other jurisdictions was so helpful, not just in the advocacy itself to get this scope of practice passed, but also when we, think about the overall public relations piece to this and communicating it to the public, that trust that patients have and the communities have in their pharmacist that is supported by things like safety and efficacy data from other jurisdictions. So in that context, a lot of the time we in Ontario will benefit from the experience of others and can use that because when, for example, I'm talking to the Toronto Star about minor ailments and we talk about, safety concerns, and we had physicians, supposing that perhaps we'd misdiagnose anal cancers, hemorrhoids, and people would die because of the minor ailments implementation. And that sounds very hyperbolic, but these are actual examples that are being used. Are pharmacists in Ontario licensed, trained, educated in a meaningful difference from that of other jurisdictions within Canada? We know, of course not, right? And so do we have safety data to support that, this is safe and effective? We do. Are we seeing cases like this in other jurisdictions? Absolutely not. So being able to speak with authority from a Canadian healthcare system context, even though the provincial systems are meaningfully different, is exceptionally important. So we talk about alignment. The one thing before I am quiet and pass this on to the next question, I do want to point out too that with alignment, we do suffer the risk of duplication. And when we think about advocacy, when we think about advancing the interests of such a dynamic profession, there is more need than there are resources everywhere, not just in direct patient care, but in this sphere as well. And one of I think the challenges that we have with organizations is that many times, because we are looking to support and fulfill the mandate of our membership, we're often asked to do specific things that may be duplication of work that others are doing. And it comes down to making decisions around, is there value in looking at having, our organization do this from our specific viewpoint and context versus, truly aligning, and that need to own something and be able to put our name on it from a member relation standpoint versus being able to just be collaborative or support the position of others and what that means from a reputational standpoint. So we really do struggle. And I think, as we'll talk about further in, those questions, that collaborative approach, the trusting relationships really do need to be in place so that we can appropriately advocate on behalf of our profession, but do so in a way that supports our own ability to survive and thrive and be able to do more of this work.
Thank you, Jen. This next question is actually really interestingly timed because I've gotten a few questions sent to me directly already on the chat and otherwise, and it's sort of coalescing around this next piece, which I think is going to be a big speaking point. So maybe what I'll do is I'll try to limit the responses here to this next question to a couple of minutes each. And if you see me coming off mute, I'm coming for you. And because I think we'll see the questions we're starting to get some that we're going to build on what we're talking about here. So it's worked out very well. The question we have is obviously we've just finished speaking about it multiple times about how challenging some of these problems are that are existing right now, particularly in Ontario. And there seems to be a level of cynicism and divisiveness both among the pharmacy profession and within other healthcare providers that's at a level that I don't know we've seen before. And I guess the question would be, what incremental changes do you feel can help support moving towards solutions to get past some of these really significantly challenging issues? And there will be some follow-up to this particular question and some of what I've already received from the audience. Danielle, maybe we can start with you first here on this one.
Okay, so this is a little, I'm gonna hopefully, I'll try to be concise, but I'm gonna argue that the way that you show up each day is, in my opinion, the most important form of advocacy that we have to offer within our themselves. So, you know, I truly believe that we represent the profession of pharmacy when we represent the profession of pharmacy to our best ability by performing our duties as a licensed pharmacist. You are doing your job. So you never know who is going to walk into your pharmacy and the doors and the tables that individual is on, and they're going to bring their experience after they leave. So I think it's really important. So advocacy to me is building healthy relationships with your patients and your colleagues, ensuring that you have all the required training and knowledge to carry out the duties that you have and do your role well, and then working to define your place in healthcare with passion and commitment. So everybody in this call should be able to sign up to do that. And if you're doing that, then you are being an advocate and helping support the work that we're doing at an association level. You know, the one other thing I will say is that there are also formal opportunities to meet with government officials. And if you ever need support doing that, we will be happy to walk you through what that could look like effectively. For our student loan forgiveness campaign, we put together a webpage that included like template letters, social media posts, ways that you can reach your MP. So there's ways to do it formally, but truly the reality is that you're an ambassador for this profession from the moment your day starts, and every interaction is an opportunity to demonstrate your value as a healthcare professional. That's how I feel. I feel like I'm a grassroots pharmacist that had a lot of passion, and that has somehow landed me in this incredible role to make a difference. And I challenge everybody on this call to take the same approach. Just be passionate about what you do and speak with conviction about the value you see in pharmacists within healthcare.
Thank you, Danielle. Good staying within the timing. Well done. That was Jen, over to you.
Yeah, I think when we think about some of the incremental changes, a lot of it can be mindset. And one of the things that sometimes helps to combat the cynicism and some of the real sort of, moral injury that can come from feeling like you're consistently attacked, whether it's, seeing something published, from the viewpoint of another healthcare provider that's supposed to be a collaborator, whether it's some of the internal strife. And, as a discipline that has, both a, publicly funded public practice type component, as well as an intersection with private business and the community standpoint, and very diverse and different practice settings, I think we do really struggle as a profession with eating our own and attacking our own before we are strategic about looking to defend. But also we have sometimes challenges, and this is not just pharmacy, but in really viewing ourselves as curious lifelong learners. And I say that in terms of, looking internally and challenging our own belief sets, knowledge, and awareness of specific issues, because when it comes to advocating on behalf of anything, understanding other stakeholders' points of view, what their arguments are going to be, why they are potentially supportive and aligned or opposed, becomes so critically important. And approaching that without as much judgment, but that curiosity, that understanding, can help you often reframe what you're looking to say in a way that may be more acceptable to a mutually agreeable solution. It might become more effective. It might become more strategic. But when we don't ask curious questions and we assume that we know what other people are thinking, feeling, or viewing, we put ourselves distinctly at risk of becoming either irrelevant or pigeonholed as only the voice on behalf of one specific interest. And I think that's something that everybody can do, and it's important in our personal and professional lives. But it's critically important when we think about how interconnected and related things like advocacy are when we exist within such a complex and, as Shelley mentioned, needs-driven healthcare system.
Thank you, Jen. Shelley, over to you for last word here, and then I've got a little detour coming up.
Oh, exciting. Just wanted to build on a couple of things my colleagues said, and I'm going to just circle back to, I think, a really important point that Jen made when we were talking about, what does collaboration look like between associations, and the very recognized and somewhat awkward conversation around, redundancy or duplication. And I think, and as Danielle said, like there's so much work for all of us to do. I think I think building trust between the formal advocacy bodies and to all of us is also very, very critical, and more critical at this time than ever. And you have to put that into practice. Just as Danielle said, it's how you show up. It's also how you show up as a collaborator. So I will tell you, and the people who are here, that I meet with Jen and Angeline and my colleagues at OPA quarterly. We met today with government. Danielle and I meet every few months when she's not having a baby. We'll be back a meeting again soon. We talk about our shared issues. We practice this as individuals. And I truly feel that that's really critical, and on behalf of our organizations. And we put aside our egos sometimes to realize that there is enough work for all of us. We will all still stay legitimate, but we really can't get in each other's way. I just wanted to say that. Going back before you detour me, I'll just reinforce a couple of things. So I think mostly about our provincial associations, to be honest, when we think about, how we are so cynical and divisive right now. And sometimes we feel like we're playing whack-a-mole. You guys have all seen that cat with, poking down his owner's fingers. That's how we all feel every day. We feel like we have a target on our back, I think, as professional advocates, and we have all these keyboard warriors on social media, sometimes personally attacking those who are working for them and saying things like, my professional body is not doing enough for me. So I think that we have to really, break down what advocacy is, what formalized advocacy is, as we talked about before, but also understand that, it is so complex. It is usually not about the fact that you didn't ask for something professionally. It's a long, circuitous road. And that, there needs to be just open and honest dialogue. And instead of making assumptions that we're not doing anything, you've just heard us all say how hard we're working and how hard everybody's working. I think there's a critical need to come together and build trust within the profession.
So Shelley, that's an interesting segue into the next. There's a few questions that came in that were very similar. I'm going to try to thread the needle and put a line of best fit between them. Building on what you just said, and I would agree that it's very easy for people anonymously on sites and on social media to be fairly aggressive. But a question has come in, I think is a good one, and it's directed, I think, probably here more specifically to OPA and CPHA. But Shelley, you may have some views on this as well, and that is that there's for frontline pharmacists, staff pharmacists frontline, that there's perhaps a mentality or a growing mentality that it's really the interest of big pharmacy or corporate pharmacy that gets served in most advocacy, because they're the ones with the resources to push behind this. And so fair enough. And so I guess the question is, number one, how important of an issue is this? And then secondly, what does OPA and CPHA specifically do to address the perception that perhaps the focus is on what's needed from a corporate pharmacy standpoint, as opposed to what might be needed from a non-corporate or from a frontline pharmacist perspective? How would you address that? Because I agree there's easy ways for people to be cynical, but I think those questions that have come in are very good ones. So maybe I'll turn it over, first of all, Jen, to you at the OPA level. How would you answer that?
Yeah, I think it's a great question. And as someone who has operated an independent myself, but understanding this sort of nuance and distinction around what the perceived interests of bigger corporate pharmacy are in opposition to that of independence. And I think that's where sometimes the narrative can become a little bit conflated, because if we think about something like, scope of practice and funding for minor ailments, that is something that, absolutely, there's going to be benefit to corporate pharmacies, but similar, commensurate, and perhaps even enhanced benefit on the independent side when you think about serving, small, rural, remote communities who may have less access to healthcare services, and you don't typically see those larger mass merchandise type locations that may house a pharmacy within. I think here really the question is around, what is our organizational association, both provincial, national, all the rest of it, policy on professional autonomy? Because I think, at the core and the heart of all of this, it's, what is OPA's stance on the pharmacy professional's ability to determine how they practice? And, I think we see a lot of these questions come up around, things like directed care, whether it be payer or, other types of contractual relationships that direct care, whether it's around things like, quotas, targets, performance metrics, whatever we want to, however you want to phrase them. And this concept that pharmacists may be asked to practice in a way that doesn't completely align with their code of ethics, or feels like it goes perhaps against their standards of practice, and what power, influence, autonomy do they have as a licensed healthcare professional that must uphold their duty of care. And that feeling of, being in a somewhat untenable or impossible scenario where you may have to choose between your employment and your professional morals. And, I can say that, at OPA, when it comes down to some of these, clear issues that would be in violation of our code of ethics, right? We think about the idea of hard quotas and saying, that, a certain number of professional services must be completed without consideration to patient demographics or eligibility. Absolutely, we stand in opposition to that, and we support the pharmacy professionals' autonomy, and we support pharmacists in practicing as they need to. And when we think about that, and I'll cut this off after because I know we're going to have other good comments on this, I also have to recognize what my organization can and can't do. I am a voluntary membership-based association that has no ability to discipline, to enforce any of this. So, or not I, but OPA. I say I from that context. But so what can we do to support? Can we equip pharmacy professionals with education around how to, communicate and negotiate with employers? And can we equip pharmacy professionals with the tools, resources, and opportunities to not feel pigeonholed into scenarios where they may feel they're untenable for them? And what I will say is that from member data and information, there are these challenges in all areas of practice in certain ways, shapes, and forms. They may look different. But when we have resource constrained environments and we look at, trying to do the right thing, there will be these challenges, and we do need solidarity within the profession and that belief in the professionals' autonomy and their ability to adhere to their code of ethics in a safe way that doesn't jeopardize their employment.
Danielle, you have the privilege of looking at things from a national lens and not being directly in the fire from a province to province, or what goes on, say, for example, in Ontario directly. But I guess the question back to you now, what was raised about the idea that maybe it's not the individual frontline pharmacists' concerns that are being considered from an advocacy standpoint nationally. What's CPHA's position on that, or what's your position on that? Do you think that's a fair representation, or how would you respond to that?
I think it's unfortunate that the media has put such a light on, I feel like it's a distraction on pharmacists in this way. And so it's clear, like the question is speaking to a greater issue, and that's the perception that pharmacists have of what we're doing. And it's actually far from it. Like, as a national association, part of what we do is to help people understand what pharmacists do. There's still that question, with physicians and nurses. People have a very clear idea of what that role is. The nature of our education allows us to be practicing in all sorts of settings, and it's not just community. My practice prior to joining CPHA was in hospital. I've also worked in industry and technology. And so how do we as an association help to bring clarity? There's a public awareness issue, I think, that needs to happen or be addressed. And we've started that foundational piece to put together a campaign to explain to everyone, including our interprofessional colleagues, what pharmacists are educated to do and how they can apply their skills and knowledge to support healthcare gaps, regardless of practice setting, whether or not that's in primary care, in the hospital, in the community. There's a role for a pharmacist regardless of where you're practicing. And I think part of that is we have a responsibility as a national organization to help change that narrative and move away from all of the media that is skewing and arguably threatening the trust that the public has with their pharmacists as a healthcare provider.
No, thanks, Danielle. And maybe I'll use that to segue over to some other questions. And Shelley, maybe I can bring you in here and you can address this however you see fit. I don't know if you feel that sometimes the lens is unfairly shone on corporate pharmacies, or if you feel that that perception is valid. And then maybe secondly, can you dive into the idea of when the issues get brought up, like the one recently on meds checks, how does that impact in your world, or how do you deal with that if somebody's zoning in on an issue like that gets brought back to one or more corporate pharmacies?
Yeah, I think it comes back to speak to what I said earlier. There is still I think there's a perception, not just from our organization and who we represent, but pharmacy in general, and a misperception, to Danielle's point, of what we do and don't do. There is still so much ambiguity in what happens behind the counter in a community pharmacy, despite all of our best efforts. I think that for us, again, as I said before, this idea of like, we represent big corporate pharmacy is something that, again, I just want to repeat and clear up. We spent a whole diverse array of pharmacy models, which is an opportunity and also a challenge. I think my personal experience as Shelley, and coming in on the inside after working for a professional association, is I have tremendous respect for the patient-centeredness at whether it's the head offices or the operators, small or big, and what they really want to do. And I think we all have a responsibility to clear up some misperception, to not let a narrative around, either perception or reality of a couple of bad actors define where we are. And that's critical now. And I like seeing on social media all of the stories of people saying, I did a medication review today, and these are the outcomes that came out of that medication review. Or I, prescribed this for a patient, and this is what happened. It's we don't want to be put on in a sort of a defensive stance, but I do think that we have to help clear up, unfortunately, the fact that we are healthcare providers, and we're sort of climbing an uphill battle right now with pressure from a lot of different places, including sort of this whole, what's happened with med review and the dialogue around that in the last couple of weeks. But we are, I would say, organizationally, a lot of what Jen says will resonate with us and our members as well. But I think individually, we have a lot of work to do to clear up some of that misperception.
That's fair. Thank you all. Jen, you've got your hand up. I'll let you jump in, and then I'll go to the next question.
Yeah, I think too, it's understanding, what our internal issues are and where we adjudicate them. When I think about some of the sort of, hot topic issues that we've had to, manage, whether it's been things like the medication reviews, meds check issue in Ontario, we also, I think, have to understand what some of those extenuating factors and why other stakeholders may use these wedge type issues to their advantage. And, I'm sure everyone is aware that the Ontario Medical Association is in negotiations with the Ontario government for their fee structure to move forward. And this concept around, adequate funding for primary care, and that the medication review program in Ontario is wasteful spending and should be eliminated and perhaps redistributed to perhaps a primary care budget. So when we think about the opportunity for others to take this type of narrative and use it against us, the way in which we respond becomes critically important, because we know in Ontario that regular medication reviews provided to patients by pharmacy teams is a key health quality indicator. And so when we think about the meds check program, yes, perhaps there are challenges, and yes, they need to be addressed. And it's not just around perhaps the utilization, but perhaps the structure of the program overall. But the issue with meds checks is not actually a physician administration burden issue, which is what it's become in the media. That this is invalid, that this has no value to patients, and that it's just a make work project for physicians. Those drug therapy problems that I have identified, those patient lives that I've improved and saved as a practitioner, is not an administrative burden issue, but that's what not being able to control that narrative turns this into. And I think, on some of these big topic issues that are critical for the type of care that we can provide our patients, that need for solidarity, and perhaps even putting, your own personal or professional interests or position aside to speak on behalf of what is best for the patient, what builds trust between the patient and their provider for a service that they may need to access, needs to be our primary focus and our primary voice that's supported from multiple sides, and is done so in a thoughtful, rational, curious way that acknowledges some of the challenges while still focusing on the value that ultimately ends up to the Ontario or Canadian public.
Thanks, Jen. We had one last panel question that I wanted to also tie into a question that was posed in the chat. And the question was posed in the chat was, and Danielle, I'll let you take the first run at this, how can someone earlier in their career, even at a stage early in their career, not necessarily just there, but even early on, what are some pieces of advice the group might have around being able to contribute to advocacy effectively? And that dovetails into another question we wanted to have for the panel, which is for the three of you, and then I'll try to keep you all to a couple of minutes here each so we can move on. What does effective advocacy look like to each of the three of you? If we look ahead a few years, how would you define what effective advocacy look like? So Danielle, why don't I give you the first shot at this?
Yeah, so in terms of the student question, thank you so much for asking it. I think it's so valuable to start your advocacy journey from schooling. Jen and I were served on CAPC Council together. So if you aren't involved in CAPC, I 100% recommend you get involved from an action that all of us could do. And, it's taken some really bad press to get people to share their good stories. Imagine if we always were sharing the good work that we did and the benefits that our interventions are having on our patients regularly as a foundational baseline for showcasing the good in pharmacy and not just when bad things happen. I think that would go a long way. And then the question about, what was the second question I had?
Just in terms of the effective advocacy, if you look in the next few years, like how would you define what that would look like?
Okay, so success obviously is a thriving and healthy population and our role in that. But I would say that when we don't have to tell people what we do and they just get it, and when pharmacists are top of mind when we're not in the room. So success to me is when somebody else says, hey, you know who would really be good to add to this conversation? Let's get a pharmacist in here. I mean, that's the ultimate goal, when other people are advocating on our behalf because they see and recognize our value.
Yeah, that's well said. Thank you, Danielle. Shelley, why don't I turn over to you? Maybe any thoughts you have for the audience and some students and new graduates and people sort of mid-career about what they may be able to contribute and how, and then secondly, what you sort of see, what you think effective advocacy looks like moving forward.
Sure. Well, for the students, I think Danielle brought up some great points and how to get engaged early on. I would also say to the educators out there, Zubin and others, let's put more advocacy in our curricula. So I have the pleasure of teaching a whole block on advocacy and out in Newfoundland. I do guest lecturing. I know Jen and Danielle also do that. When I take Waterloo students, they often tell me that they didn't really understand the complexity and they wanted to learn about it more early in school. So this is the call to action. And I know our educators around the country are doing a great job, but I think there's more we can do to build that in, to shape and get ready and for a roller coaster ride that we're sure going to all be excitingly, moving towards. And so we need to build that skill set. And part of that is teaching it in the curricula as well as getting involved. I made a mid-career change to advocacy. I worked in hospital for a long time. And then, in my early 40s, moved to an advocacy-based career, but always, as Danielle and Jen, also volunteered at my hospital advocacy association, et cetera. So I think that couple of things that I think about, Danielle talked about sharing stories. I would like us to do that more, not in a defensive stance, as I feel that we're doing right now live on social media. But I would also like us to use the currency of our patient relationships. There is nobody else that I can think of especially right now, that sees their patient, once a month, twice a month, 10 times, 14 times more than their family doctor, whatever statistic you believe at the moment. It is real, it's our currency. So let's leverage that currency and let's bring those patient voices with us. We have been criticized as being self-serving and will continue to be criticized to be self-serving. And so I think while sharing our own stories is important, to Danielle's point, hoping that others will share them when they're not in the room, but, encouraging our patients to have the agency as they have more agency to want to access their healthcare where they want to access it. Let's leverage those opportunities and tell our stories together. I think also, as Jen mentioned, last thing I'll say, which I think is critical, is that advocacy is, it's a practice, it's a way of thinking. It is not a one and done. It is not a consultation. It's not a meeting. It is an everyday thing. It's how you show up, as Danielle said. It's about building relationships. It's about, government's changing and you have to start over again. It is circuitous. It is long and arduous. And I think just to have the understanding of it, which I did not have fully until I'm still learning. So it is so complex. There is a role for each of us, but there are different layers and pieces that we play. So ask the questions and don't make assumptions, maybe, is what I would say about what advocacy can be.
Thank you, Shelley. That's well said for sure. And Jen, do you have anything you'd want to add to what's already been said with respect to advice on participating in advocacy, and then secondly, what effective advocacy looks like for you moving forward?
Yeah, I'd say that, starting early about learning to be a good communicator, and really understanding, the positioning and walking the walk of what you say you're going to do or what you say your purpose is. And, what you don't say may just be maybe just as important as what you do, but where you have the opportunity to be generous with your platform and call out or support items that may not directly or indirectly benefit you, but you take the opportunity to say and do things that are aligned with your stated purpose. And, if that is about enabling, excellence in care for Ontario's patients through, medication management services in pharmacies, then, when perhaps, other providers get a win, there is currency in supporting that, because it ultimately, if we're pro interdisciplinary care and interprofessional care and team-based care, we can't only support that when pharmacy is getting the win, because that looks self-serving, that breeds cynicism. So, being an effective communicator and collaborator is so critical. And as you start that, some of it just comes from just showing up, talking, listening more than you talk a lot of the time, which is hard for all of us, clearly. But, that becoming a really good storyteller is just so critical in that journey. And for what successful advocacy, I think, to me looks like is when I think right now, in Ontario, we're at a stage where pharmacy and pharmacy professionals are seen to be problem solvers, which we are fundamentally at our heart. And people who have problems and are now starting to go, well, can pharmacy help us with this? We have a meningitis B outbreak in my region, and I'm getting calls from my public health unit going like, how can we collaborate and work together, because you are a critical component of helping us solve this problem. That recognition is amazing. It's that first step. The second step comes from consistently being involved in all of those important groups that, deal with those problems from the root of it. And so that consistent integration of pharmacy in that structural element of our system, and having us at the table on a consistent basis, to me, that's what successful advocacy looks like, because that's the respect and the credibility that we are working and have worked so hard to build. And we really, I think, are making a meaningful difference, over the last 5-10 years in progressing that forward.
Thank you, Jen. I'm going to just wrap up with one comment and then turn over to Annalise for some questions I believe she's received. And one thing I would just give to the audience to consider is we're hearing about this from a community pharmacy standpoint. In my day-to-day, the only thing that gives us credibility with our clients is the fact that we're pharmacists. And we're actually brought to the table for that very simple reason. So I think you said some really interesting things about the interdisciplinary and sort of capitalizing on that. I do think there's also a role for pharmacy as a whole to sort of recognize some of the impacts that pharmacists participating in less traditional roles are having as well. So, Annalise, why don't I turn it over to you? I know you've got a couple questions that have come in, and I also recognize to the audience, we've got about 5 minutes left. We will be making sure we leave you on time. And so, Annalise, over to you.
Yeah, thanks so much, Mike. And thank you to our panelists. This has been a fantastic conversation. It's been so nice to see so much activity in the chat. We've gotten through many of the questions today. So there were a few questions that were submitted sort of at registration. So I'm going to do my best to sort of piece these together with the remaining minutes we have. I was wondering if maybe each of you could share sort of one piece of advice about navigating sort of personal advocacy. So Jen, you sort of talked about that, and Danielle also in your response to Fatma. But one piece of advice you'd maybe tell yourself when you were starting out of school about how you can advocate for yourself as a pharmacist starting out.
I think, it's really for me about understanding your why, because it is so hard. And it's not just being an advocate, right? Like everything that we do with the fiduciary we have in the duty of care, it has exceptional weight and importance, and that's a privilege, but it is also exceptionally taxing. And I think about all of my colleagues that, work shoulder to shoulder throughout the COVID-19 pandemic and the toll that it's taken. And so you really need to have a internal purpose, and everyone's will be different. And, there are certain aspects of your practice that light you up and that give you that meaning that, in the words of my 5-year-old, they fill your bucket. And you need to be able to go back to that and tap into that on a regular basis, because your salary, your wage, the day-to-day, the whatever sort of, community esteem that you end up getting from all of this, the internal drive about the why you became a pharmacist, why you're looking to care for patients, why you do what you do is going to be one of the only things that sustains you. And so really taking time to care for that, to cultivate it, to curate it, to develop it throughout your career is probably going to be one of the only things that keeps you loving your profession in a way that, makes you want to advocate on behalf of it, and that keeps you coming back day after day, even in the face of significant adversity and challenge.
Thanks so much, Jen. Shelley or Danielle, anything either of you would like to add to that?
I'm going to say that remember that you are a professional and you get to decide how you practice. And, you take a code of ethics, you speak to the fact that we have a code of ethics, we have a license, and you do whatever you can to protect that license and stay true to your identity as a pharmacist and the integrity piece, because there will be pressures coming to you from all angles, and you really do need to have the confidence to stand up for the practice that you want to have as a pharmacist. So just a little motivation to really stay true to who you are and don't be influenced by all the other factors that are gonna come your way.
Thanks, Danielle. Shelley, last words.
I have a daughter who just started at Queen's, so I got a couple of years on these girls, and everybody's tired of me telling her she needs to be the 3rd generation pharmacist. But I am really fond of a concept called ikigai. I don't know if any of you follow that sort of Japanese philosophy, but to me, that's what I always think about when I think about, personally what advocacy means to me. And it's about, for those who don't know, it's about doing what you love. If you could find an intersection of doing what you love, what you believe the world or your world needs, what you're good at and have some talents in, and try to get paid for it. I think that's pretty cool. And I think that 3 of us, I truly believe, have found a bit of that ikigai. I love what I do. I love my job. I am lucky that I'm part of this profession and I still practice in it. And that drives me every single day. I get excited. I got off a call 2 hours ago and had to say I love my job because I was just so excited about it. And I'm just a ridiculous optimist. But I think if you think about it from that perspective, Japanese live longer than most other people on this planet, and they live by that philosophy. So read the book. It's a good one.
Thank you, Shelley. Such a good resource, and we've put that in the chat. We are at 5 o'clock, so I would like to thank Jen, Shelley, Danielle. What an absolutely incredible panel. I think this conversation is happening at such an important time for pharmacy. So thank you for joining us. Mike, A+ on moderating the panel. It kept everyone on time. I think this conversation could have gone on for an extra hour, but thank you so much. And of course, thank you to everyone who joined us online today. We will be sharing some resources after the event, a few from CPHA that Danielle's helped pull together and referenced throughout today's event. So thank you so much, everyone, and we hope to see you at a future CPE event.